Perfect. Good morning once more. Thank you very much for having me. And as it was said, my name is Given Monama. I am all the way from South Africa. And I'm here on behalf of the SHM Foundation. So what do? I am a mentor and facilitator with the SHM Foundation. I'm working in design, implementation, monitoring, and evaluation. So a quick introduction on what the SHM is. So the SHM Foundation, slides, ne? Okay, yes. So the SHM Foundation is a charitable organization based in the UK, and we run multiple projects. We support organizations, we fund other organizations and individuals and projects. So today I'll be speaking on one of the SHM Foundation's flagship programs, which is Kuluma specifically. So Kuluma is a social support group. Yes. I keep on forgetting the slides, do bear with me. So Kuluma is a flagship program of the SHM Foundation, which provides psychosocial support through mobile phones aimed at addressing the mental health and well-being needs of HIV-positive adolescents in South Africa. Kuluma was first launched in South Africa in late 2013 across 2 clinics, which is in Pretoria and Cape Town, to provide a cost-effective, scalable solution to growing challenges of mental ill health. From the Kuluma project, a mentorship program was developed which uses the train-the-trainer model, where willing participants are trained to deliver peer-to-peer psychosocial support in digital groups to young adolescents living with HIV. The following insights which I'll be presenting are based on an ethnographic study carried out by our Kuluma mentors. So while I was engaging and networking with my learned colleagues and friends here, one of them asked me what ethnography is, right? So to provide a brief introduction and description of what ethnography is. So ethnography is a branch of anthropology which involves observing people in their own environment to understand the experiences, perspectives, and everyday practices. So why did we choose to use an ethnographic approach in this design? So by the use of ethnography, we were able to gather results which are authentic, raw, and unfiltered, because we go into the participants' environment and interact with them at their level and understand their cultures and everyday practices. To mention, this study was done under the supervision of Dr. Nikita Simpson, an anthropology lecturer at the SOAS University of London, and with ethics approval from the University of Pretoria. So, what did the study involve? So before I get into that, I want to just reiterate that this study was young people led. So young people wanted to go out back to the community, since they represent a certain part of the greater majority of people living with HIV. They wanted to go back and re-evaluate the challenges that young people encounter, since these challenges constantly change and evolve. So they wanted to go back and understand so that we can tailor innovations which deal with these challenges. So, 1, we investigated the complex and intersecting challenges that adolescents living with HIV experience through their own eyes and in their microsystem. This is their immediate surroundings, their household, their healthcare facility, and their community. Moreover, we wanted to understand how young people deal with and manage these challenges. These are the strategies that young people use to thrive and survive. And also wanted to understand how all these challenges are worsened by substance abuse and belonging to the LGBTQI+ community. Among other things, people who were involved in our study, we had healthcare providers, hospital stakeholders, caregivers, adolescents living with HIV, and members of the LGBTQI+ community. We wanted to gain insight into social and structural barriers to addressing the mental health and adherence needs of adolescents living with HIV, and also how these stresses might be mitigated to prevent poor mental health and adherence in adolescents. So, speaking to a few of our observations, I'm not going to touch on all of them. However, I think as we all know that transition from adolescence to adulthood is quite a difficult process for young people. It is characterized as a stage where there is great physical change, psychological, social, and behavioral challenges, which often impact the mental health of adolescents and their medical adherence. And speaking to a few points, as other abstract presenters and other presenters have mentioned, we also noticed that transition from pediatric care to adult care or adult immunology has quite been hard on adolescents. As a study that was done by Brian Zanoni in the mHealth intervention, this process where young people are moved from from pediatric care to adult care, this is quite a very hard process since they're moving from a more nurturing care, a more caring environment to where now you have to act and be an adult. No one is going to focus on you as an individual. However, you are going to have to make means or be comfortable with the tough love that they want to give you. Okay, I'm on time, thank you. So, after all this, we were able to determine that safe spaces are key to young people. So what are these safe spaces? These safe spaces are places where young people can be free, comfortable. This involves their healthcare facility, their community, their immediate surroundings. These are key to young people, and these have a great impact on their mental health and overall adherence. As one of other presenters who mentioned that we need adolescent-friendly clinics, which are tailored to provide specific adolescents' needs, since adolescents want these specific spaces. There are a few things which our mentors who carried the ethnographic study said when participating in the ethnographic study, which I'll not touch on a lot, but this was done to build research skills in them and also to make sure that they are able to understand young people and build better healthcare facilities for them. Pardon me if I stumbled and mumbled a bit, but yes, that was my presentation. Thank you very much.